What is regression? As a therapist, sometimes you'll think, okay, I'm going to regress them to a baby scene. I'm going to regress them when they were only 8 years old. I'm going to regress them even between 5 and 7, when we presume that's where all the trauma, all the problems lie. How do you know that? How do you know that your client is going to find what the issue is if they go back to that scene? How do you know that? We don't all have issues in that age group, baby scenes, when we're still carrying the baby. We think that, oh, that's where it's, they don't go back to a scene, so it must be because when they're still in the womb within that 9 months. No. We want our clients through advanced conversational therapy to go and regress if they need to. Maybe they might not regress to an age. Maybe they might even not regress at all. Maybe they might even regress to what happened yesterday or a month ago or a week ago. We don't care where they go in advanced conversational therapy because we don't know what our client's issue is. We don't know where it all started. We, as advanced conversational therapists, will be very curious, starting off with what the problem is and just going from there. But we teach you just not to think about what the symptoms are, what the story is that your client's saying. We want to move away from that. We want to be able to question their emotions. We want to question how is it making them feel. We want to go into asking more about them in a very vague, in a very open way so that they can figure out, is it going to be a conscious belief? Is it going to be an unconscious thought? Is it going to be a conscious way of thinking? Is it going to be an unconscious way of thinking? Open-ended questions is going to be how your client is going to find where the problem is. And it could be going into regression or it might not be. But at the end of the day, you, as the therapist, don't need to presume, don't need to take them back into some inner child traumatic scene or even in the womb. Who knows